welcome. Today we'll be talking about ulnar deviation and how to measure it through goniometry. So first I'll be speaking about the anatomy. So we're going to be talking about the radial carpal joint in terms of ulnar deviation, where we have the radius, we have the scaphoid, and the lunate, and the trichetron. When we do ulnar deviation, we're going to have the convex surface of the bones moving on the concave surface of the radius, and this will cause a subsequent slide radially and a roll on the ulnar side. Now, the muscles that ulnar deviate are going to be the flexor carpi ulnaris as well as the extensor carpi ulnaris. Any structures that will be limiting this motion would be the joint capsule itself, the tightness of those radial deviators, as well as possibly the lateral collateral ligaments. Indications for measuring ulnar deviation with a goniometer would be where somebody has an observable limited range of motion of the wrist, either due to general tightness or to an extended period of time of immobilization. Contraindications would be where somebody has a suspected wrist fracture or they may have pain intolerance. So these psychometrics for ulnar deviation. So we have reliability for interrelated reliability. The ICC was from 0.78 to 0.91. Validity, the R value was negative 0.76 to negative 0.86. And we got both of these sources were gotten from the Norkin and White. Measurement of joint motion, a guide to goniometry. It was the 4th edition of 2009. So to start off with measuring ulnar deviation, we're going to have the patient sitting in a seated position with their arm at a 90-degree angle on the table, with their arm elevated to about a neutral position. Now, we're going to have the arm exposed with our bony landmarks for measuring our goniometer. We're going to have our axis, or our fulcrum, is going to be at the position of the capitate, which is the center bone of the carpal bones. We're going to have our stationary arm coming from the capitate, moving down along the arm. Now, if they're in this position, you can use a lateral epicondyle, but for all intents and purposes, we're going to be having it along the posterior part of the arm right here, midline. The movement arm is going to be along the third metacarpal, and will look like this. We have our movement arm going along here again, along the third metacarpal. We have our fulcrum going to be on the capitate, and we're going to have our stationary arm in the mid-forearm. Norkin and White cite the American Academy for Orthopedic Surgeons that the normal range of ulnar deviation is between 0 and 30 degrees, 30 degrees being normal range.
Hi Amanda, my name is Adam, I'm your physical therapist. I know that you're in here today for a little bit of wrist pain, some tightness and soreness, is that correct?
Yeah, it's been pretty tight, I'm not sure why.
Okay, I think what I'd like to do to start is check a measurement of ulnar deviation, which is just you moving the outside of your hand to the outside of your arm there.
Okay.
That's going to give us some indication of what your range of motion is, what we have to work with, okay?
Okay.
So the first thing I need to do is raise this table up so that I can get you in the correct position. We want your arm, if you can just rest your arm up on the table there. We want your shoulder to be at about 90 degrees of abduction. That looks pretty good. And your elbow here is going to be at 90 degrees of flexion as well. Okay, so what I want to see you do is go ahead and go through that movement. I'm just going to kind of stabilize your arm here to make sure that you're not compensating with any other movements. And just move that wrist out as far as you can.
So as far as I can go.
Okay, that looks good. Go ahead and go back to the neutral position there. Okay, now I'm going to go ahead and just relax that wrist, and I'm going to move this myself to see if we get any additional movement, okay?
Okay.
Okay, so the next step here is I'm going to go ahead and take this measurement, just stand so that I can get a better view of the goniometer. I'm going to hold the stationary arm just so it's bisecting, running down the midline of your forearm. The center of this is lined up in your hand, and then the moving arm here is just right down the the center of your hand here.
Okay.
If you can go ahead and go through that movement again for me. Okay, that's at about, it looks like about 38 degrees of movement there. Let's go back and go ahead and go back to neutral. And then just relax your wrist there for me, and I'm going to go through the movement myself. Okay. I have about 39, we'll say 40 degrees, which is within the normal standard deviation measurements. So those measurements are pretty similar. It leads me to think that you really don't have any tightness in those structures. So that's the